be talking about the updated infectious system in Iraq, given by Dr. Yasser Mufid. He is consultant physician and he is the head of medical microbiology department in الأنبار College of Medicine. He is a fellow in Iraqi board pathology, microbiology and immunology, and he is a member in European Society of Clinical Microbiology and Infectious Diseases. You are welcome to the Yasser.
Thank you. Good morning, everybody. This lecture actually started with a, let's say, 10 days history, previous 10 days history. We were visited by Dr. Nicholas, who is an FRC physician in infectious disease 10 days ago, and then we had lunch. And I recall when I was a student at medical school, and Dr. Abdullah Abbas used to tell us always to ask about traveler's history. So I asked him a simple question. I told him, if a patient came to your clinic, not to your hospital, and he had fever, and he told you that he was abroad, he came from Iraq, this is the primary infectious disease you will suspect, which microorganism will, let's say, jump out. He told me, actually, I will think about typhoid. And I was truly amazed, because truly typhoid, although there are a lot of rumors here and there that this is endemic in Iraq, but truly I've seen only one case in my true practice. The patient came to the emergency department and he told me in his words, please open my head, I've got severe headache, and he was febrile, and he had normal heart rate with a normal IBC, typical septic case. And the rest of the cases that through all my practice I saw, they came, I think I have typhoid, I think I might have fever, and these are not symptoms of septicemia. So actually I started Googling to update my knowledge about infectious disease in Iraq. And I was astonished that the WHO never gave any warning signals to whom travels to Iraq about typhoid. They gave many other microorganisms to be aware of, but typhoid wasn't one of them. And there were no statistical data, either by the WHO nor by the Ministry of Health, about the number of cases in our country. Only a report that in 2004 there were approximately 5,460 patients, and it raised some concern about this type of infection. From here we'll start with the good news about the classical infections in our country, which I will discuss, and we'll try to update them for today, and I'll leave the bad news to my colleague Dr. Haytham to follow me and give you the new emergence of new microorganisms. Well, let's start with our oldest enemy, which is tuberculosis. The WHO actually reported that our health situation is improving, and that since 2013, the number of cases are dropping, and we are now regarded as part of the low-burden countries of TB. In my department, or sorry, in our department, there were many researches about tuberculosis. Many of my colleagues conducted researches on tuberculosis. The latest one, which tested four governments in Iraq, showed that yes, there is a decrease in number of cases in the rural areas, but the urbanized cities, the numbers are actually increasing. And the second thing we observe is that the number of extrapulmonary tuberculosis is rising. And as you can see from here, the major governorates which show the highest percentage of tuberculosis is Diyala, Wasat, Diqar. Now, the other common disease, or let's say endemic disease in our country is brucellosis. Brucellosis, again, in our department, there were many researches about brucellosis, and the data we collected showed that there is a marked drop in the number of cases. The last research we conducted in our department showed that there's a change in the criteria. We used to think that goat's milk is responsible, and most of those who actually milk the goats are the women. But in our latest research, we observed that this job has been shifted to the male gender. And since the female is not milking the goat, it's not spreading. So it was very hard even to collect true cases of brucellosis. We needed to reach remote rural areas to gain cases of brucellosis. Still, the northern states, mostly Slemania, is endemic with brucellosis. Now, for the water of the area, which is mostly caused by E. coli, the WHO actually stated that the problem in Iraq is actually in the quality of water. The quality of water we drink, which is highly contaminated with E. coli. Yes, there were outbreaks of cholera in 2007 and even in 2022. Most areas which were affected are actually in the northern governorates of Iraq, and again Baghdad being the center and most acceptable area. There were documented cases also in the southern governorates of Iraq, and again it was related to the quality of water. Hepatitis A, the WHO actually stated that Iraq is at high susceptibility for being infected with hepatitis A, and there are concerns the need of vaccination for this type of viral infection. For the matter of hepatitis B, there were researches, and again the WHO showed that the water pollution and the bad quality of water is responsible for the transmission of hepatitis E viral. The water they tested showed a contamination again with E. coli, indicating that it is sewage water that is responsible for the transmission of this virus. Hepatitis B and C figures show that they are scattered, and the reports state that it is mostly heterogenic, mainly related to therapeutic approaches, contaminated instrumentation, which is responsible for the transmission. Hepatitis C shows a low level of endemicity in our country, unlike hepatitis B. Plain Congo hemorrhagic fever struck our country. There are some suspicion that it could be a terrorist attack. Mostly the governorates in the south were the highest documented governorates, and especially the Aqar, with a number of 47 cases. And it is rising according to the WHO. But the good news about this viral infection is that we have reported the least mortality cases in the world. Less than 8% of the mortality cases, unlike the global, which is 30%. COVID-19, the last outbreak finished in 2022 in the end of August month. And the distribution were mostly in the central capital, Baghdad, and also the capital cities of Iraq, with the high crowded cities. Measles, on the other hand, started with 2 outbreaks, the first in 2015, and the second started at 2023 and continued through 2024. It started from the west and gradually transmitted to the southeast of Iraq. The cause was the decrease in number of vaccinated children, and due to the conflict and war that affected our country, caused these children not to be vaccinated and increase the risk of this viral infection. Rabies shows two figures, and it is very interesting, this type of viral infection. The number of animal attacks to human is huge in the southern states of Iraq, but the number of documented cases of rabies is somehow different. It is much more in the urban areas than in the rural areas, which might indicate that there is urbanization of our rural society. The age incidence is actually more than 15 years, and male to female ratio is quite the same. We are glad to pronounce that we are now free from poliovirus. The last two cases were documented was in 2014, and they were related to a wild human poliovirus which came from the conflict in Syria. So it was a Syrian serotype. HIV still, we are low in number, but a research conducted in this college proved that the number of cases is actually rising, and we need to be well oriented to this gradual rise, and you can see it is a sigmoidal rise. Again, the Ministry of Health in Kurdistan and in Baghdad celebrated that we are free from malaria since 2009. Although I heard yesterday that there were 2 cases reported in Scan being diagnosed as malaria, but there are sporadic cases and were not completely documented. Cutaneous leishmaniasis is actually showing a different a change and a shift in its forms. In 2022, there was an outbreak of 8,000 individuals in Iraq, mostly in the remote rural areas. But the change and the shift in the climate showed cases in hope, which means that the sandfly actually is changing its environment due to the desertization of the country and also the climate change. Again, visceral leishmaniasis has got a seasonal change, and it's also affected by the climate change, and it is shifting towards the eastern part of our country. Bilharziasis, the WHO stated that we are free from all cases of bilharziasis, and again a research which was conducted in our department showed, by collecting data over the years of the number of cases of bilharziasis, shows a dramatic decrease in number of bilharziasis. And with this decrease, there was a shift in the squamous cell carcinoma, which was mostly the common type of bladder carcinoma in 1965 to a more transitional cell carcinoma being the most dominant, which is the global figure of CA bladder. Hydatid disease, this data was very hard to collect because unfortunately all researchers were of surgeons. And I actually found a research which was collected from the Ministry of Health showing that again the southern governorates are the mostly affected. Females unfortunately are the highest percentage. Age is between 15 to 44 years. And I'll be leaving the bad news to Dr. Haytham. What I'm trying to say here is that there's a triangle in our country, Iqar, Muthanna, Najaf. This area is as you can see from all the pictures I collected, showed the highest incidence of endemic diseases, and mostly due to two things: climate change and the contaminated water. So we need the Ministry of Health to concentrate on these three governance, and thank you very much.
Thank you very much. Thank you very much. Sorry.